Hi, I'm Dr. Emily Grant with Benefits Health Systems coming to you from Women and Children's Center. I'm one of our general pediatricians here at Benefis. It's not uncommon for toes, especially the fourth and fifth toes on each foot, to curve in a little bit. If this is something that's been present since birth, it's not getting worse, it's not painful, you don't need to schedule a specific visit to talk to your healthcare provider about it unless there's a new concern. You could just bring it up at the routine well visit. Typically, treating it at home is not necessary. Most of the time, this is a benign or harmless condition. Probably the best thing to do would be to just make sure that if your child's wearing shoes, that the shoes are not too tight in the front part of the shoe, also called the toe box. If this is a new thing that's just coming up, if it's getting worse, if it's something that you've noticed after an injury, or if it's got swelling and redness, then I would definitely say that's a more urgent reason to get in with your provider. Most commonly, children start showing some signs of interest in potty training around 18 months to 24 months, so somewhere around that second birthday. Majority of kids have achieved some potty training by age 3, especially for during the daytime, and the majority of children are potty trained at night by age 5. Just because your child is struggling doesn't mean that there's something medically wrong or that you're doing anything wrong. Most important is to keep the focus positive. Punishing, lecturing, spanking children for having toileting issues is not appropriate and can worsen the problem. Constipation is a common cause of toileting issues, both with initially learning to potty train, but then also if children have a negative experience and start holding their stool, that can worsen constipation and contribute to more toileting problems. So if you notice your child has constipation issues, I would recommend talking with your child's healthcare provider about what you can do to help relieve that, which would facilitate and make it easier to potty train. If your child's having difficulties getting toilet trained after age 3 during the day, or if they're still having accidents at night after age 5, I would recommend that you follow up with their pediatrician just to make sure that there isn't something else that's going on. It could be contributing to these issues, and then also to kind of help you understand what best you can do to help support your child during this learning phase. So it's not uncommon for children, young children and toddlers to sweat during their sleep. Their systems are in general less mature than an adult, and also just their body surface area is different, so they do tend to struggle a little bit more with heat regulation, so sweating at night isn't uncommon. The biggest thing I would say is that if this is a change for your child, or if there's other symptoms like fever, poor appetite, weight loss, or fatigue, then that associated with the sweating would be more of a reason to bring them in to be evaluated. If your child has chronic medical issues, these can be related to nighttime sweating, so that would be another reason to bring it up with your healthcare provider. As we head into our warmer months and spending more time outside, I just wanted to kind of reinforce the use of sunscreen. SPF 30 or higher is great. Higher doesn't necessarily mean better. The higher you get, it's incrementally less protection. Actually, more important would be frequent reapplication. So reapplying that sunscreen every 80 to 90 minutes or when getting out of water is going to be really important for your child. Ideally, avoiding the peak sun time between typically 10 to 2 is also another way to protect your child's skin. Wearing hats and long-sleeved clothing, for example, rash guards, can also help protect skin. It's also really important to remember when we're camping and outside, insect repellent, especially at dawn and dusk, just to try and prevent mosquito bites, which can be irritating, but also mosquitoes can carry diseases too. And then with water activities ahead, really just want to caution and remind everybody that toddlers are especially vulnerable to water accidents and injuries. So please always designate an adult to be supervising the children. This is one way to share a responsibility. You can get a lanyard or something that you pass from adult to adult that says that that person for that period of time is going to be watching or paying most attention to that child. But it's important for life jackets and water safety that toddlers are never left unattended. Unfortunately, drowning is one of the most common causes of death in young children, and so it's really important to take those extra safety precautions this summer.
Hi, I'm Diane Evans. I'm a Peds nurse practitioner, and I'm here at Benefis in the Women's and Children's Center. I've been a nurse practitioner for 28 years, working only with children. Well, the first part of that answer, what you can do to help a healthy gut in children, is basically mostly food related. Healthy diet, lots of fruits and vegetables, extra fiber, all of that kind of stuff's good. Mainly normal 3 meals a day, 2 snacks, lots of water. All of those things are going to help. Most children don't need an extra probiotic unless they're having some kind of digestive issues, and often that's something we talk about in your office visit. We worry about after a virus you don't feel good and you need them for a while, or if you're having some problems with constipation, sometimes we'll use probiotics, but on a general basis, children don't need those every day. As far as bad microbiomes in future, there's some really probably good ongoing research for that, but at this point in time, we don't see a link to that, having problems in childhood linking to adulthood. Some stomach issues, GI upset, different things are more genetic in basis, but at this point not necessarily related to what you're eating as a child. We get this one a lot. Q-tips are technically not safe. We don't really want anybody to put anything in their ears. You can certainly clean around the outer side of the ear with a warm washcloth or with a Q-tip, but if you see wax inside or any object inside, it's super important to allow a medical person to pull that out. Sometimes wax is super protective and doesn't cause any problems with children's hearing or illnesses, so if it's in there and not bothering anyone, we like to just leave things alone. We do see a lot of people and babies, smaller children especially, struggle with dry skin in the winter, sometimes when the seasons change, like it's seasons now with spring and fall. Current research really states that bathing isn't necessarily a good or bad thing with dry skin. What the trick is to not use a lot of soap, bubble baths, chemicals in the water. If you let babies or toddlers play in the warm water, enjoy themselves, have a good time, and then soap up and get out right away without sitting in the soapy water or perfumey bath bombs and things, that's going to be more protective for their skin. In the long run, the other trick to any dry skin is to bathe children, and after they're out of the bathtub, within that first minute, using a good perfume-free sensitive skin lotion and really rubbing them down really well, and that prevents a lot of dry skin more than anything. We really wanted to try to address today the importance of yearly physicals and making sure that your child is seen yearly at our new Women's and Children's Center. We have a variety of things we talk about at well checks, including making sure your child's growing well, any concerns regarding health issues, just general care and help for you. We often can address some mental health issues or worries about school. We also like to make sure we're catching up on immunizations and people stay current on their vaccine schedules. Anytime after May 1st, we can do sports physicals for middle school and high school students. We often can do that with your child's annual physical. If you could do your sports physicals in early May, June, after that May 1st time frame, that would be wonderful. We often see a hard back-to-school rush at the end of the August. We'd appreciate if you came early and made appointments as soon as possible.
Thank you again for your time and for watching today. If you have any other questions or want to schedule an appointment, please give Benefis Pediatrics a call at 406-731-8865 or visit our website to schedule online.